Welcome to Speak Life with Dr. Amy Chai. Information for your best life. Now, here's Amy Chai.
Hello, everyone. I'm Dr. Amy Chai, and you are watching Speak Life New Haven. And today we have a very special show. We are going to be talking about your brain. And your brain, as you know, has a lot to do with how you think, how you behave, how you feel, and how you live your life in every way. But it also has a lot to do with addictions. And today I'm going to focus a little bit about how your brain changes with addictions. And if you have somebody in your family who is addicted, or you have trouble with addictions yourself, I think this is an incredibly important topic for you to listen in on. And I think you're going to want to stay tuned in to hear a little bit more about how addiction affects the brain. So addictions, as you know, are very, very common. And, when we think about addictions, we usually think about, alcohol, drugs, tobacco. But there's a lot of other addictions too. People can be addicted to their work. People can be addicted to sugar. And the mechanism of addictions in the brain is the same for all of these addictions. Now, if you think of your brain as a beautiful bonsai tree, you can think a little bit about how your brain grows and changes. Have you ever seen a bonsai plant? It's like one of those tiny little trees like they have in Japan, and they trim and they prune little branches until the tree is a beautiful, perfectly designed tree. And it's really a work of art. And your brain is kind of a work of art too. The decisions that you make, the things that you do every day, actually make physical changes inside of your brain. Think of it as like pruning the bonsai tree, or putting a plant up on some sort of a trellis to train the plant to grow in a certain way. That's a good analogy for how a brain develops. And your brain isn't developed until you're about 25 years old. It isn't fully developed. But certainly as you go through life and you try to learn new things, your brain actually changes. So there's two kinds of brain processes that I want to talk about as to how they work in addiction. The first one is procedural memory, and the second one is emotional memory. So we're going to talk about procedural memory first. Almost everybody, when you're a little kid, one of the most exciting things you can ever do is learn how to ride a bicycle. And a bicycle is something that you get on the bike, you fall over. You try to pedal and you fall over. You do this again and again and again. And each time you fall off your bike, you're training your body, you're training your muscles. And that's a procedural memory. What's literally happening is you're literally changing the pathways in your brain so that certain nerves in your brain are connected in a different physical way. So if you haven't ridden your bike for a while, and maybe you're older and that bike's been in the basement for years, you bring the bike out, guess what? You don't have to teach yourself to ride your bike again, because your brain has actually changed. And now you have a procedural memory. You'll never forget how to ride your bike. So I'm going to introduce you to my little friend. This is my friend His name is Bob, and he is actually a styrofoam head. But what we're going to do is we're going to illustrate certain types of memory that Bob has in his head. So learning how to ride a bike, that's a procedural memory, and that's a brain change that goes on in Bob's head, okay? So you can also learn a certain other type of memory, and that type of memory is emotional memory. And I'm going to take some emotions, and I'm going to put some emotions in Bob's head too. And you notice the emotions and the procedures, they're kind of linked together in the brain, okay? So let me put him down for a second. There we go. So when you have certain emotions, you have certain procedures or actions that go along with those emotions. Like, for example, if you're sad, you had a really bad day, you're really depressed. You may be wandering around the house feeling blue. And then all of a sudden, next thing you know, there's a spoon in your mouth because you've just started comforting yourself with that pint of chocolate ice cream that was in the freezer. And you don't really even remember opening the freezer. You don't even remember like taking a scoop out. You're like, what am I doing? This is emotional eating. And emotional eating is when you have an emotion, sometimes you'll associate it with the action being to take a spoon and fill it with ice cream. There's another type of emotion that could be associated with a procedural memory, and that would be, say, for example, anxiety. Now, imagine that you're at work and you have a fight with your boss. You're just replaying in your mind over and over what your boss said, what you said, whether it was fair what your boss said, what you would have said instead if you had had a few minutes to think about it. And before you know it, you're home. You're driving into your driveway, and all of a sudden you sort of wake up and you think, how did I get home? I don't even remember driving home. Has that ever happened to you? It's actually happened to me where I've just driven home on autopilot and I don't even remember driving. And a lot of times emotions and emotional states and mental states are associated with procedures or actions that are ingrained into our mind with our neural circuitry. And then the actions become almost automatic. And that's the way it works in addiction as well. We know in addiction that people, places, and things can trigger certain emotions that trigger relapse. If someone has been drinking and they stopped and they see a person, a drinking buddy that they used to go drink with, then they're much more likely to drink when they're with that friend. And all of us have this experience. For example, if you're on a diet and grandma comes over and grandma has made her famous homemade cookies, and those cookies just fill you with this emotion of comfort, of home, of family. And you're like, oh, grandma, thank you so much. You're a lot more likely to take that cookie and just start eating it because of the person that offered you the cookie. If you go to a restaurant, maybe it's a restaurant, maybe you went there with your significant other for your first date. You associate that restaurant with feelings, and that feeling, maybe it's romance. So maybe you just have an extra special feeling of like romantic feelings for your spouse when you go to that same restaurant. Or a thing like a handprint. Maybe you have a handprint that your child made on construction paper back in kindergarten, and you say, oh, that's so cute. I'm going to save this forever. And so it brings a feeling in your heart, and that's a nostalgia feeling. So it triggers certain emotions. People, places, and things trigger emotions. And so that's what happens in the brain. And in the brain, those emotions are actually triggered to certain behaviors. So in addiction, certain emotions, certain people, certain places, and certain things are often triggers for procedural behavioral memories, which creates what we call cravings or the desire to use, or even the action of just going out and using before they even realize what they're doing. So, what I'm trying to say is relapses will happen. Relapses always happen because addiction is a brain disease. It's a brain disease that has alterations of the brain that will not change. And therefore, there's always going to be that risk of relapse. And so let me share here with you a image here. Let's see if I can get this up. There we go. Let me see if I can get this any bigger. Here we go. Okay, that's better. So this cycle of addiction is illustrated by the 4 causes that we have. And the first cause I want to draw your attention to at the top, we have a molecule of DNA, and that represents our genetics. So about 50% of what we experience with addiction comes from inherited genes. If your parents had problems with drugs or with alcohol, then your chance of having problems with drugs or alcohol are greatly increased. And so that genetic susceptibility, it's about 50% of all addiction. Now, the next picture you see is the globe, and the globe represents the environment. And by the environment, I don't mean grass and trees. By the environment, I mean the people around you, the neighborhood around you. For example, if you're living in a neighborhood where there's drug dealers on every street corner, you're much more likely to experiment with drugs than if you live in a sheltered cul-de-sac where you wouldn't even know what a drug was. Also, if you're in poverty, if people around you have mental illness, if you have traumas in your life that make you feel bad or that trigger certain emotions, then those things in your environment are also going to contribute to addiction. At the bottom, you see another picture of the brain, and that is brain changes. Now, in Mr. Bob, the styrofoam head, we saw how the brain changes with memories of emotions and procedural memories. And those are physical changes in the brain. But there's other changes that can happen as well. And those changes in the brain can come from things like trauma. If someone has been abused, that can create physical changes. If a person has a mental illness, those are changes in the brain that can certainly contribute to the development of the disease of addiction. And the fourth picture that we see is behaviors. Of course, our behaviors, some behaviors are chosen behaviors, and some behaviors are almost automatic behaviors. But there is definitely a behavioral component. And really, the only thing that we as people have control over is our own behavior. We don't have control over our genetics. We don't have control over our environment. And we don't have control over the traumas that we've experienced or mental health issues either. So that puts a huge burden on us to modify our behaviors to control addictions, and it is not easy. It is not easy because you see all these factors working against our sobriety. So what we see is a number of reasons that people develop addictions, and we see a number of reasons of why it's difficult to change our behaviors when it comes to certain triggers, especially emotional memories. And a lot of those are triggered by traumas. So now we see that the risk of relapse for someone who is struggling with addiction is very high. In fact, it's almost unheard of that someone has one episode of addiction and never has a relapse. But it's very, very important that we understand this, because there's a lot of stigma about relapses. There's a lot of stigma about relapses in the community that surrounds our friends, our family, our neighbors who suffer from addictions. Okay. So what we experience oftentimes is people are unaware of the factors that contribute to relapse and of the factors that make it really difficult for people to change their behaviors enough to control their addictions. And so it becomes a stigma whenever someone relapses. It's not only bad enough that people will beat themselves up, but they will have family members, significant others, friends, neighbors, and colleagues who will also beat them up and say, oh, they're on the bottle again, or they've fallen off the wagon, or, look at them, they're, using drugs again. And with that comes a certain amount of judgment and stigma. And that's not a good way to help people overcome their illness, especially when we're dealing with opiates and we're dealing with our fentanyl crisis. Because what we find is that people who relapse from opiate addictions are much more likely to die now in this era of fentanyl, because they've been doing well. And what happens is when people use drugs frequently, what happens is they develop something that we call tolerance to the drug. That means someone, for example, let's say they're shooting heroin or they're shooting fentanyl, okay? Because that's probably the most serious addiction problem that we have in our country today is the opiate addiction. Now, what we have is people who use large amounts of opiates, and their brain has developed tolerance to these opiates to the point where they can take really huge doses that would, kill an elephant, and they're alive and they're fine and they're functioning normally because they just have so much tolerance. Okay. And what they have also is they have their emotions, and their emotions may be getting triggered. Maybe they're sad, maybe they're depressed, maybe they broke up with their significant other, maybe their boss yelled at them. They have an emotion, and the emotion leads to the procedural learned behavior, and then the drug use goes on. Okay. So what happens when they go and they get treatment? Well, if they are able to stay off opiates for long enough, what happens is they lose the tolerance to opiates, but they still have their emotional memory and they still have their procedural memory. So what happens next is, if something happens that triggers their emotional reaction and triggers their procedural memory and causes a relapse, but they no longer have tolerance to the drug, in this day and age with so much fentanyl on the streets, then they're likely to die with a relapse. And that's what we find to be so concerning about the stigma to treatment for opioid addiction in particular. Because there's so many people who think, oh, going on methadone or Suboxone, that's just substituting one addiction for another, when nothing could be further from the truth. Methadone and Suboxone, what they do is they actually save people's lives, because a person who is completely opiate free is going to lose their tolerance to opiates. And they could be doing well for a few months or a few years, but when the relapse happens, they're probably going to die. But if a person remains in treatment, they're much less likely to relapse because they're getting treatment. And also they have some degree of opiate tolerance, some degree of cross tolerance, because the treatments with buprenorphine or methadone, they have some cross reactivity. So it does maintain some of that tolerance. So what you're doing with treatment is you're actually saving people's lives. And when we blame and when we shame patients for getting treatment for their addictions, we're basically subjecting them to the possibility of actually literally dying because they're not in treatment. And I would just like to leave you with an analogy. Imagine that you had diabetes, right? If you have a diabetes, you may actually be literally physically dependent on a drug called insulin. And say someone had a blood sugar that was 600 or 700 or 800, they were in a coma, they were on the floor, they got brought to the intensive care unit, they were going to die. But the doctors brought them back with the magic miracle drug called insulin. And then they get prescribed insulin to take home. And they tell their family, look, let's go to the pharmacy. We're going to pick up this insulin. My doctor told me to take insulin for this diabetes that I have. Now, what if the family said, oh, no, we're not going to take that insulin from the pharmacy because insulin is just a crutch. You're going to be addicted to that insulin. You're going to need that insulin to live. And I don't think that that's right. I think you should be strong enough to have diabetes without insulin. And so they don't pick the insulin up. What would happen? Well, chances are very, very good that that person without the insulin would find themselves in the same place that they were before, with a crazy high blood sugar, maybe 600 or 700, and they will be back in the intensive care unit. Now, we don't shame people for having diabetes. We don't tell them, oh, don't take insulin because insulin is, just an addiction because you need that drug. And whenever you need a drug, that's an addiction. No, we all know that insulin is a life-saving treatment. Sure, some people can wean themselves off of insulin over time if they have a really perfect diet, but most people can't. Some people can, most people can't. And in the same way, there are many people who can eventually wean themselves off of opiate treatments like methadone or buprenorphine. But there are an awful lot of people who really can't or really shouldn't wean themselves off of those treatments, because those treatments are what are keeping them stable, keeping them in treatment, and keeping them away from a relapse that could end their life. So please, if you're a family member and you have a loved one with addiction, please encourage them to get the treatment that they need. Encourage them to stay in treatment until they're stable enough to taper off. That may be 1 year, it may be 5 years. And in some people with mental health conditions, we really don't even recommend tapering off because there's so many triggers that come from their traumas. So it's not a shame to be treated for addiction. It's a life-saving intervention. If you would give your loved one insulin, and in fact, if you would demand insulin for your loved one, please demand treatment for your addicted family member or your addicted friend. That's what's going to save their life. And remember, addiction is a disease. It comes from genetics, it comes from brain changes, it comes from the environment. And it's very hard to just use behaviors to change this disease. Some people can, but some people can't. And please respect the needs of the person that's dealing with the disease and be as supportive as you possibly can. So that's my talk today about the brain and addiction. And I'm going to have some more talks coming up about different types of addiction. We're going to talk about opiates. We're going to talk about marijuana. We're going to talk about alcohol, cocaine, and some other addiction topics. And I hope you'll come back and listen to more Speak Life New Haven. And remember to speak life into someone's world today. See you later.
Next time for Speak Life with Dr. Amy Chai at ctpolitics.tv.